We're using the cells within that to actually inject that back into the joint or back into large areas where you have problems. We're actually using those cells to improve function and to reduce pain. So there's two major types of treatments that we utilize when we're talking about treating arthritis or treating tears or treating other things that are affecting joints. The two big things are what we call Regenexx SD and Regenexx SCP. Regenexx SD is what we consider our classic stem cell procedure. And what we're actually doing with the Regenexx SD is we're utilizing concentrated bone marrow aspirate, where we're actually taking those samples from your bone marrow, we're concentrating it down, and we're using the cells within that to actually inject that back into the joint or back into large areas where you have problems, whether that's the joint itself or whether that's large rotator cuff tears or tears in meniscus tissue or tears in big ligaments like the ACL in the knee or other ligaments within the shoulder or the labrum that can be causing a lot of pain and problems with stability for people. With that, we're actually using those cells to improve function and to reduce pain. So those cells do create, and basically how it works is as we age or as we have injuries, sometimes the body is not great at providing the healing response to those areas like the joint or tendons because the blood flow there isn't naturally that good. So what we're doing is we're bypassing that and extracting those cells directly and then injecting them in a very precise form using very precise tools like ultrasound or X-ray guidance to place those cells directly where they need to go so that they can provide the best outcomes and give you the best functionality. The other option that we have for treatment is something called Regenexx SCP or super concentrated platelets. Now this is very similar in practice to what people would know more commonly in the community as PRP or platelet-rich plasma. Basically the premise of this type of procedure is you're taking platelets from the actual blood supply, you're concentrating those platelets down into very high concentrations compared to what you would see normally in the blood, and then you're injecting those platelets directly back into the area where there's tissue damage or any other structural issue that's causing problems. And basically the platelets, like stem cells or like bone marrow concentrate, act to actually provide direct healing elements and growth factors into the areas of tissue damage. So platelets work better in a lot of ways for more minor injuries, things like chronic tendonitis or rotator cuff tendonitis, tendon issues in the knee. Sometimes I've used it for issues in the kneecap where people will have arthritic changes or other tendon issues, small muscle tears, hamstring tendon tears, Achilles tendon tears. And these types of treatments have been very, very helpful for improving tendon integrity, improving outcomes with pain, and improving patients' overall function. It's a little bit less involved in terms of how we extract those cells. Platelets come directly from the blood, from a blood draw, just like you would give at your PCP's office, whereas the bone marrow concentrate has to come from the bone marrow. But when you're dealing with more mild tendon injuries, smaller areas of tendon tears, the platelets can be very effective. If you're looking at bigger areas of pain, larger tears, larger amounts of arthritis, that's really where the stem cells shine a lot more and where people have a lot better outcomes that way. If you subscribe to this page, like this video, comment in the comment section below. We can reach out and answer any questions that you may have. But also, we're going to go through some more videos that are going to help you learn a little bit more about these procedures, and we're going to give you some additional information to help to continue you on your journey to getting better. What you can do today is give our office a call. Our number is 412-963-6480. You can talk to our regenerative representative. She'll get you set up on the schedule to be able to come in and actually see us for an official consultation. And we can talk more about what you're experiencing, whether it's shoulder pain, knee pain, hip, back. We treat it all. So don't feel like you wouldn't be a candidate for these procedures or that there's not something that we can do to help you. Come in and get your questions answered and come in and see us so that we can definitively let you know what we feel like we can do for you.